Okay, so today I want to talk about what's commonly known as the slip disc. Now, this phrase infuriates me because it's so misleading and provides a really false understanding of what is actually going on with low back pain. It's commonly used, it's commonly referred to by people within the medical profession, and I include physiotherapists with that, but it is a horrible term which is really misleading. First of all, it implies that the disc slips or moves out of place. This could not be further from the truth. The disc does not move. You have many discs in your lower back, you have discs in your thoracic and discs in your neck. Discs do not move. They are very strongly supported, they're very well positioned and they're very well designed to not move. They are your shock absorbers. They do not move. Now the reason it got this name is because the disc has a softer centre and they are much firmer and more turgid and strong on the outer part of it. As a result of this, sometimes you get a tear in the outer part where the soft centre then starts to leak into that and creates pressure either within that wall or within the outer wall, or even creating a slight bulge to the back. That's where it got its name from, because of the displacement of the centre part of the disc. But the disc does not move, the disc remains in place, and the disc can heal, can get better. So, for instance, the majority of people who are walking about the street may have some form of disc bulge, but are totally pain-free. So the correlation between scans and disc pain is very, very difficult to correlate. So we get very little information from scans. X-rays can't see it, so they're a waste of time. So we don't do them anymore if we suspect it's a disc-related problem. This then means that because of the term slip disc, people get very fearful of moving because they think something's out of place and they think that needs to be put back into place. And they think potentially that manipulation is the way to do that. Now firstly, manipulation doesn't change the position of the joint, it doesn't alter the joint, but it does alter your pain mechanisms and therefore can result in less pain and can be a beneficial treatment, but not by the way that you may think it does work. And it certainly wouldn't put the centre of a disc back into its position. So let's get clear that manipulation doesn't fix a slip disc. Slip disc is not good terminology. In fact, we'd really rather avoid using that terminology altogether. And let's just talk about back pain. Let's just talk about it as simple mechanical low back pain. And then we can start to focus on what you can do and what you can do to make it better. And we have lots of experience in treating this. We treat it on a daily basis. It is one of the most common conditions we see. It affects 8 out of 10 people at some point in their life. Therefore, lots of people experience it, but lots of people hear this terminology, become very fearful of movement and think that it's unsafe to exercise or that they need a scan. Simply, you don't need a scan. Very few people require that. Provides very little good information. Nothing's out of place. Nothing needs realigned. And exercise and movement is good and it's safe to do. But it's difficult to know what level you need to start at. And that's where a proper assessment, proper diagnosis will allow you to get proper treatment and start your journey to recovery. But back pain can get better, persistent back pain can get better, disc pain can get better, mechanical low back pain can get better. And please don't use the term slip disc. A disc has never slipped, it's never fallen, it's never been out of place, and it won't ever be. So hopefully that's let you know a little bit more about low back pain.